Ladies and gentlemen, let's welcome Christopher.
Meet Nekesh, a 32-year-old mother of 6 living in Goro, a small rural village 400 kilometers outside Addis Ababa, the capital of Ethiopia. On April 12, 2018, her second youngest child, a daughter, Kiddist, aged 4, became very sick. She'd been coughing, feverish, with a cold for the 3 days prior. The nearest health post was over 100 kilometers away, or 8-hour journey by donkey cart. As the days progressed and she didn't get any better, the villagers came together and pooled what little resources they had to send Nekesh and Kiddist to the health post. After a grueling 8-hour journey, they finally arrived, only to have to wait another 6 hours as there was a queue leading out the door and only 2 nurses working the post. When it was finally her turn, a tired and overworked nurse, they briefly examined Kiddist, and she told Nekesh that Kiddist was fine, it was just a cold, and she'd be better by the end of the week. With no other recourse, Nekesh took Kiddist on another 8-hour journey back home. 3 days later, on April 18th, 2018, Kiddist passed away. Unfortunately, due to time constraints and pressures and overall lack of training, the nurses had failed to realize that Kiddist's fingertips and lips had started to turn blue and that she had serious trouble breathing. All potential warning signs for pneumonia. With appropriate testing, she would have been correctly diagnosed, and with the proper treatment, very likely would have lived to tell the tale. Instead, a tragically preventable death occurred. As uncomfortable it is to hear stories like this, Kiddist's fate mirrors that of millions of other children all across sub-Saharan Africa and the world. Pneumonia in low-income countries leads the list in causes of death for children under 5. And it, as well as the majority of all the other diseases on that list, are highly treatable if caught early and treated. If Nekesh and Kiddist were born in Boston, where I was born, or in Taipei, where I live now, this would never have happened. So why does such a massive health outcome disparity still exist in 2019? Today, we'll dive into this problem, and for sake of scope, we'll specifically look at low-income sub-Saharan African countries, such as Ethiopia, those that require the most disruption. Why are adequate healthcare services not accessible for everyone in these regions? Well, from a macro level, there's a multitude of reasons, but the most important is the severe lack of trained medical personnel, medical professionals in rural areas. To get an understanding of what we're dealing with, here's some numbers. In Europe, there are over 30 doctors for 10,000 people. Taiwan, there's 22. In Ethiopia, there's less than 1. And with the majority of doctors residing in centralized urban locations, this means that those rural outposts, like the one that Nekesh has visited, simply have no access at all to any healthcare professionals. And with roughly 4/5 of Ethiopia's 105 million people residing outside of urban areas, that leaves over 80 million people with simply no access whatsoever to healthcare. That's 80 million people in one African country. So what can we do about that? Well, the easy answer is obviously, let's train more doctors. Well, we have friends that are doing that right now. This is the Nordic Medical Center. It's a prestigious hospital and teaching institution located in Addis, and they're also a partner of ours. Each year, we train a certain number of doctors and nurses and release them throughout the entire system. However, together we've done the math, and it's not enough. Even if we increased year over year, we still wouldn't have enough 40 years from now. So what can we do if that's not enough? Today, I'm going to talk a little bit about the technological trends that I personally witnessed and how I foresee that this could be a way to a better healthcare future. How the synergy between AI, connected tools, and technology and humans could possibly lead to a new class of medical personnel, ones that could be trained instantly and from practically anyone. And these, in turn, these medical personnel, aided with AI-powered tools, can then go into the environment, treat, diagnose, and help lower the overall burden. Utilized in the correct way, with the correct systems in place, this could possibly be the solution to the healthcare problem. But before we can start, I have to take you back to 2014. I had just finished a 6-month volunteering stint in northern Thailand, and I joined HTC's innovative R&D department, formerly known as Magic Labs. At that time, they were working on the $10 million Qualcomm Tricorder X Prize, a global competition that uses monetary incentives to encourage teams from across the world to take on the world's next big challenges. The Tricorder X Prize was inspired by the science fiction TV series Star Trek, in which doctors would use this device to instantly diagnose a host of diseases and then take appropriate action. The competition's rules was to try to create a device, portable, small, medical, that was able to diagnose a range of diseases, from skin cancer to pneumonia, and to do it in an easy, user-friendly way. Through a combination of data analytics and decision trees, we were able to diagnose the majority of these diseases. And through service design, user experience design, and interaction design, we created a step-by-step protocol that anyone could use. During that time period, I couldn't help but imagine the possibilities and the impact that something like this could have on healthcare in the future. Just imagine a volunteer armed with these devices, strategically deployed throughout different areas in rural communities. There, they would be able to help diagnose and treat simple diseases, preventing them from ever becoming life-threatening issues. And by catching it early, they would also vastly reduce the downstream healthcare costs associated with treating the later stage versions of these diseases. This is the type of scalability that this kind of thing could bring. However, due to the limitations still provided, there was still not a way that we could actually solve this problem. Because when we created this, we could only diagnose a number of diseases. If we really wanted to take that next step, that step towards healthcare accessibility for all, we would need something stronger, something smarter, something more adaptable. Something like a artificial intelligence data analytics cloud. We call this IDAC. The IDAC would be the brain, the data analytics and management powerhouse that would take devices like the Tricorder to a whole nother level. Now, when the device meets a new disease, something that it wasn't pre-programmed to do, it would be able to use this as an opportunity to learn, to improve. Using supervised machine learning and taking in raw sensor data, it can also build a training model based on what the final outcome was, the outcome being the doctor's diagnosis. And once it has an algorithm that works, it's proven and tested, it would be able to scale and send this update over the air to every other device. Let me put that in perspective. What I'm saying is that once one device learns something, every single other device can gain from that same knowledge. And this is the type of scalability that AI and machine learning can bring. Once we've done diagnosis, why stop there? Why don't we tackle the treatment process as well? Through connectivity and measuring along the connected cycle, we are able to track a patient's long-term health outcomes based on symptoms and long-term result. This means using a combination of unsupervised as well as reinforcement training modules, we have the opportunity to discover new treatment plans that no human being has ever thought of before. So how does this type of AI-human integration actually look like? Well, I think the Tricorder is a great example. An example of how the right type of technology applied can make a huge difference and make anyone into a quote-unquote health professional. But there's one thing that I haven't mentioned yet, also the most important element, which is by leveraging the machine's ability to be a machine, we also have the most underrated and most underappreciated element in the entire healthcare delivery cycle, and that is the human element. And the human element of empathy, of compassion, of connection, and cultural understanding. By leveraging the machine's ability for calculation, that means we can let the humans be humane, building the much-needed trust and connection that we would actually need to actually implement in these communities, in these traditionally very difficult to work with environments. And that is why, combined, this kind of technology with the scalability factor, calculation factor, and the human factor is able to unlock millions of people to become these functioning medical personnel. And these, in turn, could be the way that we bring millions of people across sub-Saharan Africa access to healthcare. This is a future that I believe in. This is a future also that Kiipo, the company I co-founded with Jordan Masys, believes in as well. At Kiipo, we believe that everyone has a fundamental right to a healthy life. And we're building the different tools to make that possible. Currently, Kiipo is building our health tech ecosystem in health data analytics AI. Officially named the Kiipo Artificial Intelligence Data Analytics Cloud, that's a long name, we just call it KAI for short. KAI is a continuously improving data analytics AI specifically focused on healthcare, and it is the backbone of our entire Kiipo ecosystem. Now, although it's very much in early stages at this point, we've been in Ethiopia for the last 5 years, and we've also been building the different systems and infrastructure to allow this to be possible. Jordan is also a founding team member of the Nordic Medical Center, and our team has built the first ever emergency medical services system in the country, in operation for the last 3 years. Our goal is to push out from there, to expand this across all of sub-Saharan Africa. And with that, let me bring you back to Ethiopia. This time, the not too distant future. Esnekish is now a grandmother of many, but this time, when her granddaughter gets sick, she can take her to a nearby health post, only 20 minutes away. And at the post, the staff, a diverse mix of volunteers and nurses in training, armed with the latest in KAI analytics skills, are able to instantly diagnose and treat and take the appropriate action. The world that she is now living in doesn't have the same diseases as the ones she was grow up in. This could be our reality, but I don't know when we will ever reach this, or if we do, because it's not going to be easy, it's not given. We will have a long journey, an arduous path. There will be skeptics and there will be naysayers, and there will be different things that will come in our way. But as long as we challenge the status quo, if we're able to change the shift, the way that we look at healthcare and what human health and vitality really should be, I am confident, I am optimistic that we can get there. And I'm optimistic because I think together, collectively, we have the opportunity and we can overcome this challenge and build this future. So today, I am asking everyone here with me to join us on that journey. Commit to making the most advanced healthcare technology accessible, not just to the few, but to all. Let's make this planet, this world, our only world, a better, healthier place together. Thank you.